I'm Byron. I'm an internist. Lori is a pediatrician. And what we'd like to do is talk a little bit about the effects of climate on nutrition, agriculture, and human health. If we stutter a little bit, that's because it's backwards the way we usually do it. We usually talk about human health first, being physicians, but bear with us. We're here, Lori and I have worked for 20 plus years on the Crow Indian Reservation in southeastern Montana, and since then continue work in public health. Lori is a pediatric hospitalist at St. Vincent's and Billings. As I said, I'm an internist. I work at a community health center in Hardin that we started a number of years ago. But throughout our careers, we've been very interested in public health. Unfortunately, like many people, we're also slow learners. It was probably 5 or 10 years ago that, despite having been doing this for several decades, and we started looking around and realizing that climate change is the biggest public health issue out there, period. And started getting active in that. The picture you see here of 6 or 7 or 8, I don't remember, Native American children in beautifully hand-beaded cradle boards kind of represents what it's all about, and it's about the kids and the next generations. So when I talk about public health, think of it this way. When somebody walks into an office, or say to an exam room where I'm going to see him or Lori's going to see him, we focus on that one person, or maybe that person and their family. Public health is more about populations, larger groups. And a big thing about public health is it's about prevention. This slide just shows about 10 of the common chronic conditions that those of us over, this says 65, I like to say 30 have. But of these 10 conditions, 8 of them are going to be a lot worse because of climate change. I can make a strong argument for the 9th one as well. It's hard to say that climate change is going to affect high cholesterol, but the solutions that we all know about in the room actually will improve our cholesterol. So it kind of filters in there too. The other thing is to point out is that the Lancet Commission in 2015 said tackling climate change could be the greatest global health opportunity of the 21st century. And I think a lot of us agree with that. It's a scary thought, though. And this afternoon in our presentation, we're going to take down a little bit of a journey. I'm the doom and gloom guy. I'm the one that's going to talk about the aspects of climate change that will affect our health. Lori is going to be the upbeat person who addresses a lot of the solutions, which everybody in this room almost is working on already. But when we talk about climate change, what are we talking about? Kind of a busy slide, but on the inside, increased CO2 levels and other greenhouse gases, increased temperatures, more extreme weather, and rising sea levels, which maybe that's not too important to us in Montana, but it will be eventually. Next layer out, severe weather, extreme heat, increased allergens, water quality impacts, and then on the outside of this slide is the specifics of it. Increased asthma and cardiovascular disease, increased infections, forced migration, heat-related illness, and what's probably one of the most important in here, and should have a bigger thing, is the lower left. It says malnutrition, which is what we'll emphasize a little bit this afternoon because of the effects on our food supply. One tangential, or one thing I'd like to point out here is in the second ring it talks about air pollution. Let's be clear, climate change is being caused by air pollution, or at least man's part in it is. Not only that, but climate change will increase air pollution, so it's going to be a vicious positive feedback loop. As temperatures get hotter, ground level ozone increases. So not only is that causing the problem, but the problem will make it worse as time goes on. Now, last year, as a result of the work of Dr. Maxwell, who's in the room, and several others, the Institute of Ecosystems from University of Montana and Montana State came out with the Montana Climate Assessment. So what do we expect to happen in Montana over time? We expect temperatures to increase. They've already increased about 3 degrees since the mid part of the last century. They'll go higher. Precipitation is projected to increase in the winter, spring, and fall. That's an important distinction, but probably decrease in the summer. Our snowpack has declined since the 1930s, particularly more so since the 1980s. We expect earlier snowmelts with increased spring runoff, which will reduce late summer water supplies. Groundwater demand will increase because surface water will be less, or that's the expectation or projection. And we've always had droughts. We will continue to have droughts. They will be more common and potentially worse. That's what's anticipated. To boil it down a little more, throughout the West, we expect increasing temperatures, decreased snowpack, increasing summer drought, and increased wildfires, very much related but not exclusively because of climate change. One of the things to think about climate change is that it doesn't cause everything. It doesn't cause diseases. It doesn't cause some of the other problems that we'll talk about related to health, but it is going to make them worse. So let's start not with humans. Let's start with what's really important, and that's with plants and food. So what do we expect with climate change in general? Well, as it warms, crop pests and pathogens can extend poleward. In other words, in the northern hemisphere, farther north, southern hemisphere, further south. And this shows, I think it's a nematode, but that also applies to plants, to invasive plants and plant pests. It turns out that a lot of plants and weeds do much better with climate change than the food crops that we grow. Now, I'm old enough, and maybe I learned it wrong way back when, but for a long time thought that, well, gee, plants grow in CO2, they like CO2, they do good things with it, more CO2 is good. Well, it is good for some plants. Unfortunately, when food plants, a lot of our particular grains grow in increased CO2 environments, they have decreased protein. That'll become relevant in a minute. There's also decrease of some of the minerals, particularly zinc and iron, when they grow in an increased CO2 and at warmer temperatures. And then particularly with increased temperature, there's decreased productivity in a lot of grains. Now, keep in mind that for those of us in the United States where we are, shall I say, flush with calories, and a lot of us don't want for extra calories, that's not the norm in the world. We'll talk more about that in a minute, but if you take somebody that's living on rice or other grains and drop the protein content of that, which makes a major part of their food supply, and they're already borderline for malnutrition or frankly malnourished, it just gets worse. And research in the United States has shown, for example, that for every day above in the growing season for maize, the temperature above 84 degrees, which is not a lot, there's about a 0.7% decrease in yield. Now, granted, that is current strains or older strains, and hopefully that can modify, but just for perspective. And then by the end of the century, some projections are that our maize yield will decrease by 1/3. In increased CO2 environments, the soybean pests like aphids and Japanese beetles like the plants more when there's more CO2. The ones that feed on soybeans in the CO2 environment also live longer and lay more eggs. Let's figure out where that one's going. Oh, that's right. The high CO2 environments also suppress the plant's ability to fight them off. This is a picture from last year in northeast Montana when we had the severe drought there. And just speaking with one of the ranchers last week, he said that his crop yields were about 25% of what they had been before. And unfortunately, that's one of the concerns of what we're going to be seeing as time goes on. Now, the other thing, though, is going back to that Montana climate assessment of talking about when the rains might come, The other thing that most climate assessments suggest is that we're going to have more extreme weather events, which means, particularly in Montana, actually our overall changes don't look that bad. We're going to have, or the estimates are about the same amount of water, about the same amount of precipitation. And unfortunately, it's going to come in much more intense events. So over years average, that's great. But if you're growing crops, that's not so great. This is a picture of a supercell taken in Montana from a few years ago. And with the increased water vapor in the air that comes from the increased temperature, being able to take it more up, we see more intense precipitation events. And that's one of the concerns. So, talking about malnutrition in the world, and this is several years ago, so it's probably higher, but 3 million children a year die from hunger. That's about a third of the pediatric deaths globally. 1 of 8 people on Earth lack an adequate food supply. In the United States, 14% of people are not food secure. And in fact, now the American Academy of Pediatrics has asked pediatrician and family practitioners to ask families and parents when they're doing well child care, are you food secure? That's an important question that we just paid no attention to before, and we need to nowadays. And just for some perspective, this is from 2010, that shows sort of where the food supply in the world is coming from. And if you look, North America, South America, and Australia are in the positive category. Europe's kind of a wash, depending on the year. But everybody else, at least as of 2010, was in a negative category. So if something happens to, it's a relatively concentrated amount of food, and everybody else is big importers. Looking at it another way, in the United States, about 6% of our typical income goes towards food. In some countries, it's 20 to 50% of an annual income for people goes towards food. And this shows some projected costs, real food costs that are expected based on some of the changes we look at. On the left, it says processed food, processed meat, and then we go to rice, livestock, wheat, and then rice, paddy rice on the far and maize on the far right, with increases of 50% or more in cost. And somebody that's already spending 20 to 50% of their annual income, which is inadequate to maintain at first place, and gets these kind of prices, they can't survive. Let's talk a little bit about humans. It'll be fairly short. In the United States, the number one climate-associated cause of problem, actually, in terms of human health, is extreme weather, is heat. For all the hurricanes and everything else, not as many people die as they do from heat-related illnesses. And that's everything, the ones we think about, heat exhaustion or heat stroke, dehydration, okay, that kind of figures. But heart attacks, stroke, dementia, lung diseases. A very good study in the past year or so which took healthy college students, put part of them in a I'll say a dorm, but in a building with air conditioning, and part of them in a building without air conditioning. They did a test. A few hours later, they repeated the test. The ones who were in the unheated building did not do nearly as well. So that's a couple of hours. Think about the heat waves that we're starting to see. And then I call it indirect heat-related impacts, particularly to some spread of infectious diseases, mostly because of the vectors. Now, as mosquitoes and ticks can spread farther, they can carry the diseases further. We've seen, not too much in Montana, but certainly across the nation, a lot of closures of freshwater and also saltwater contamination from increased algal blooms, from blue-green algae or cyanobacteria, and then the drought that we talked about. And this is just one example. On your left shows the range of one mosquito, Aedes aegypti, which carries a lot of diseases. On the right, it shows also the range of another Aedes mosquito, the tiger mosquito. Both of these carry dengue, Zika, potentially yellow fever, and malaria. Now, we have not seen large outbreaks of any of these diseases in the United States yet, and part of that's because we don't have enough for them to spread the disease, but we have seen increases. Worldwide, we're seeing fairly significant increases in these. And here's a picture of some of the algal blooms that we've seen over past years. And I guess to end on a depressing note of my part of this, mental illness worsens with temperature increases. There's increased violence, there's increased depression, there's increased anxiety, more suicides, domestic violence. And one thing, in Montana particularly, unfortunately, one of the things we lead in is suicides. Montana in the past 10 years has been in the top 5 states for most number of suicides per capita. The variety of reasons, they aren't climate change, and I'm not saying they are, but that's probably going to get worse. Just from the temperatures alone, it could, but also from the increased problems that we're seeing with ranchers. And I put on here, ranchers with the 3rd highest rate of suicides in the United States. That's behind, I believe veterans was high, and the other is young adults. So, all right, on that happy note, I'm going to turn it over to Lori.
That despite the depressing effects that climate has on human health and nutrition and ag, I think there's actually a whole lot of good news, and that's what I'm here for today. And many of the same things that are going to improve planetary health are actually going to improve human health. And first I want to apologize because there's people in this room that know a whole lot more about what I'm going to talk about than I do. So you can correct me later for things I say wrong. And I'm trying to walk a fine line between those of you that are brilliant in ag areas and those of you that might know less than me, I'm not sure. So a couple fantastic pieces of news. And the first major point is that the Rodale Institute and many other research centers have found that if we actually shift to regenerative organic agriculture, that we could actually sequester 100% of the CO2 that's now being produced. There's a lot of different people, a lot of experts, international ag experts, agroeconomists and scientists that are saying this now, and that's really fantastic. And ag is really the only sector that has the ability to transform from being a net emitter of CO2 to an actual sequesterer. I will say the building sector, we can now make net zero buildings, and we can even make buildings that are slightly positive towards CO2, but nothing near what we can do in agriculture. And that's really exciting. And so carbon sequestration or carbon farming is just putting carbon back in the soil where it belongs. So in Montana, what I've been told is that we were about 18% topsoil back in the early 1900s, and now we're about 1 to 2% topsoil, which means we've lost all that carbon into the atmosphere. So we can put a lot of it back. And of course the reason it was lost was by doing the farming that none of us are advocates for, the farming where you have lots of erosion from water and wind, from tilling, from monoculture, from overgrazing. So that's the first really super cool point. Another really neat thing is that organic foods are increasing in America. So we're now at 5.5% of retail sales is organic, which is really good, and it's been increasing over the last few years. I think it's tripled in about the last 10 years. And so that's good, both because organic farming is a mitigation, which means it's reducing emissions, but it's also an adaptation because crops that are grown organically survive a whole lot better. And so just a small example, and this is just fields where you just have strips of organic and strips of non-organic. And this is in drought conditions, and the organic fares a whole lot better because it's a much better water holding capacity to the soil, of course, which all of you know. And because we're going to be seeing more of those summer droughts and late summer droughts, this is really important in Montana as well as the rest of the world. So the second really great point related to agriculture and nutrition and health and climate change is that we can probably feed the world with organic and sustainable methods. And Dr. McGale this morning confirmed that. This particular quote is from the World Watch Institute, but there's a lot of really good institutions and research people that are saying that this is now true. And that's not what people used to say, of course. Note that in some of the lower income countries, when you're selling foods locally, you really might not be able to be totally organic because you're not going to get the extra money that you need to farm organically, but you can do it sustainably. And so not only can we potentially feed the world organically, but this isn't even looking at the externalities. So when we think about externalities with fossil fuels, we're thinking about the fact that what you're paying at the pump isn't paying for all the negative things that aren't being paid for, like the air pollution and the human deaths and the contamination of the environment. For organic methods, we have positive externalities. So without even accounting for these externalities, like having less erosion and less chemical pollution and less deaths to humans and animals, it's still a positive. We can still feed the world organically, plus get all those extra good effects. So there's also a little bit of leeway. So let's say we can't totally farm organically and get the exact same yield. Maybe we only get 90 or 95% of the yield that we're currently getting. I think we have several fallbacks, both in America and in the world. Nobody here is really old enough to, but you might have read about it. Who's heard of victory gardens? Not the ones that they're talking about over there. Yeah. So back in World War II, the government asked the American people to start growing their own gardens in their own yards. And if you'll recall, back in the 1940s, their yards were very small, but people were able to grow a third of the vegetables that were eaten during World War II from their own yards, which is pretty impressive. And we can do that again if we need to. So there's a little bit of fallback. And of course, there's just tons of new innovations, and a lot of that's coming from exactly you all in this room, from the MSU students, from the researchers. There's just so many new cool things that are out there. This is a hydrogen fuel cell tractor in the upper left. It's not on the market yet, but it was actually made in 2009. It's not quite economically viable yet, so New Holland hasn't started producing them. But other things like the no-till crimper roller down in the bottom is, of course, and that allowed people who no-till to do it organically. So there's just a lot of technology and a lot of innovation that should be able to help us move to improve human health and the planet's health. But some of us in this room are not sustainably farming for a living. So for those of us that are in here, what can we do to help the people who are helping fight climate change? And I actually didn't do a slide, but I thought about it this morning, so I had a note to remind myself. For those of us that aren't scientists and maybe have some fine art skills, one of the good things we could really do is to make organic farming sexy. I mean, it's kind of sexy, but it's not sexy enough because there's not enough people going into it. It was really great to hear that a couple of these students are actually thinking about becoming farmers that were not from farming families. Have anybody seen the Peterson brothers? I think it's the Peterson brothers on YouTube. Anybody seen them? You gotta look them up. Yeah, they do this rap music, but they're conventional farmers, but they do make it sound pretty sexy. So we need that because we need more people doing this. So, so one of the things we can do, and I know most of you in here are doing it, is supporting farmers markets. But there's actually a lot of things with farmers markets. I'll try and relate it to health. So of course you're avoiding transportation costs, and the average food item that you buy in a grocery store has traveled 1,500 miles to get to you. So we're lowering greenhouse gas emissions when we buy locally. And a lot of them tend to be more sustainably grown, so again, we're lowering greenhouse gases. The other thing is it supports your community and it increases a sense of community. And the sense of community actually improves not just our mental health, but our actual physical health. There's been a lot of good research showing this. Also, we know that the healthy habits of kids are improved the more they have sensory input. So being in farmers markets, touching vegetables, having activities around vegetables, all those things is going to improve their interest in being healthy people. And then it promotes mindful eating, and mindfulness is a positive thing, not just for our mental health, but for our physical health. So all of those things are helping both humans and the planetary health. And another thing we can do is embrace those ugly vegetables. So there's a real movement to do this. I did ask one of the students that worked on a co-op this summer, and they did not have an ugly vegetable track, but I know some of the CSAs you can sign up to get only ugly vegetables, so they're not being wasted. Because, as most of you know, food waste is a huge issue. And in fact, if food waste were a country, it would be right behind China and the United States, the largest amount of greenhouse gas emissions in the world. So we're losing it because a lot of it's left in the field. We're losing it because it goes bad in the grocery store, or because it rots, or because it's ugly. And we waste it in our own refrigerators. And then to further the damage, it goes on to our landfills. And unless your landfill is capturing methane, then it's producing methane. And we learned in the resilience tent this morning that just for Missoula, you have 280,000 tons of food waste going to your landfill every year. I mean, that's just overwhelming. And in fact, food waste is the #1 thing that's in our landfills. So embrace those ugly vegetables. Anybody heard of edible landscaping? Some of us might not love farming, but it's hard to not love something as beautiful as that. So we can beautify our lawns and help insulate our homes and plant bee-friendly pollinating plants, or bee-friendly plants, and also lessen the amount of our yard that we're having to mow, or maybe even, God forbid, fertilize or use chemicals on. And all those things that we do outdoors, again, improves our mental health and our physical health through increased exercise, improved mood. And I know this is controversial to some people, but considering a more plant-based...
You know, there's so many important synergies that can be between agroecology and public health. They're fundamental. I mean, we're just starting, we have a society in Latin America that we're now bringing public health and doctors into the conference. Because the data that you're showing on the declines of productivity and so on is mostly for industrial agriculture.
Right.
Organic farming systems and agroecologically designed systems are going to behave differently. And there's some very interesting data that is coming out. For example, I don't know if you saw that recent paper about probably there's going to be less cancer in people that eat organically. And then all the work that has been done by Daphne Miller, you know her?
Yes.
She wrote a book called Pharmacology instead of
Yes.
pH, it's F. And the studies that are fascinating is about what happens with children that are fed organic versus children that are fed this junk food. That they're less susceptible to diseases and allergies and many other things. Even hyperactivity can be reduced. I wanted to hear your perspective on that, you know, in terms of the positive impacts on health, and how much would that save from the public health? I mean, how much money are we spending in public health for people that are eating all this food that they're victims, actually. And there are people that have no other choice but to eat what they're eating. I just wanted to hear that perspective.
There's probably more range on the percentages than there is in the amount of carbon in the soil. But yeah, there's no question that Daphne Miller is great. It's a great book. And there's no question that the things we've talked about, in that you know, the chemicals and herbicides and pesticides and that kind of stuff, you know, not to mention all the stuff that's in plastics that's in every one of our bodies. Yeah, I don't even think we can begin to calculate the medical costs. So.
Oh, there's another question somewhere. Oh, there's another question. Oh, yeah.
I was just wondering about your perspective, because you worked with a traditionally very oppressed population, and with seeing all these problems come down the line, I was just wondering what you have seen, and these are a group of people that probably don't have any food sovereignty really as well, and just how that experience has been for you, and how it might contrast with how we'll be managing the same things here in Missoula.
Okay. Good question, and very pertinent. First of all, is unemployment on the Crow Reservation, like many other reservations, is over 50%. And Crow is unique in that they are sitting on some of the largest coal reserves in the United States. So, in one sense, and some of my biases will come out, I'll be careful, but is basically we took a population, put them on a reservation which was not good land. All of a sudden now they have a revenue stream, and we, whoever we is saying don't develop it because it's damaging us. There's a problem with that. But I'll also say that's the same problem that goes with people that are working in coal mines or working at coal strip and other places that are in the extraction industry. It's not their fault, and they can't solve it. We are the ones that have to solve it, and by we, I mean everybody. And the only, and again, another strong bias, is the people that aren't involved in the conversation. A good percentage of us live in the United States. Most other countries really have been involved in this and are way ahead of where we are. Particularly when you look based on a dollar for dollar basis. So we're the ones that really have got to get out and start talking. But good question, because it is a problem. And personally for Lori and I, it's been frustrating because how do you address that? I mean, how do we do that without saying it's your fault or not having a solution for those for how do you make an income? That's part of the discussion. The other point I was going to make earlier is virtually everybody in this room, by virtue of the fact that we're here, is already engaged, is already doing something interested, which is important. But in the United States, the studies out of Yale, which does Yale Climate Connections, have shown that now it's over 60 to 70% of people in the United States actually believe in climate change, believe we need to do something about it, but less than 20% of us talk with anybody about it, like our family, our friends, or whatever. The first step in doing something is starting to talk about it so we can start to address some of these issues like the one you raised and I brought, and like Dr. Maxwell points out, these aren't easy answers, but we can do it, but we got to start talking about it to figure out how do we do this, realizing that we're very polarized right now. So, thank you. Yes, sir.
Because you're both physicians, I wanted to ask you this question. So what you're talking about would be substantive behavioral changes for us individually for the future in addressing climate change. I mean, substantive behavioral changes in our communities. But because you're both physicians, I'm wanting to have you give me an answer for what explains rapid obesity in the United States. Where does that come from? And why is it growing among children, elementary school, and it's epidemic? We have food waste, unparalleled food waste. We have extraordinary obesity in young people, and it's growing. Can you give me a bigger address? I don't mean to have you blame climate change, but there may be some odd connection. I'm just trying to figure it out as a citizen of this country who's watching all the other health side effects happen from this.
Well, we are eating more. So I mean, if you look at the calories, the caloric intake is up by several hundred kilocalories per person per day in America from what it used to be. But again, there's so many things like we know that a lot of the chemicals, like the chemicals in plastics, the PFASs and the PFOSs and all those things, are endocrine disrupting hormones. And they actually, so some of the obesity actually is not necessarily preventable because they do turn on different genes in our body, and they do, make some people more prone to obesity than they were before. So I mean, it's a hugely multifactorial thing. Being more sedentary, not being farmers, watching more TV, playing with our cell phones, having our genes turned off and on, and then there's the whole field of epigenetics where the trauma that not only your parents but your grandparents underwent is actually affecting the kids, 1 and 2 generations later.